Can isolation gowns protect you against COVID 19? Choosing isolation gowns or PPE gowns might be difficult during traditional capacity times when PPE is in short supply. With the necessity for disposable isolation gowns bulk every day or even per shift during crisis capacity periods, the decision might be even more challenging. What exactly are isolation gowns? Isolation gowns for healthcare can be classified into two types for COVID 19 or other infection control reasons: surgical and non surgical. A surgical gown is a piece of personal protective clothing used by healthcare workers during surgical operations to safeguard both the patient's and the physician's health from pathogens, bodily fluids, and particle matter. In low/minimal risk patient isolation circumstances, a non-surgical isolation gown is a protective garment used to shield the individual from pathogens and bodily fluids. Can isolation gowns protect you against COVID 19? First and foremost, let us begin with a yes. Now that we've assured you that isolation gowns are a COVID 19 safety measure, let's talk about how. To combat the COVID 19 pandemic, the main objective is to safeguard frontline healthcare workers from COVID 19 transmission by touch or transfer of bodily fluid droplets. Not only are throwaway patient isolation gowns vital for protecting healthcare professionals from COVID 19 infection, but they are also important for protecting patients. Level 1 basic fluid resistance provided by a non-surgical isolation gown is probably sufficient for this purpose, eliminating the requirement for Level 3 or Level 4 surgical gowns. If the COVID 19 patient is admitted to the hospital with additional underlying diseases, surgical isolation gowns are the top pick for safety. What are isolation gowns? From a medical equipment manufacturer constructed to avoid these bodily fluid transfers. These gowns are often constructed of cotton or synthetic material such as polyethylene/polypropylene or polyester. Synthetic fabrics are preferable to cotton for minimizing COVID spread because they are more effective at limiting fluid transfer. Infected bodily fluids are prevented from coming into touch with the bodies of healthcare staff and patients, preventing the spread of COVID 19 infection.